VOXZOGO is a prescription medicine used to increase linear growth in children with achondroplasia and open growth plates. VOXZOGO may cause serious side effects, including a temporary decrease in blood pressure in some patients. To reduce the risk of a decrease in blood pressure and associated symptoms, dizziness, feeling tired, or nausea, patients should eat a meal and drink 8 to 10 ounces of fluid within 1 hour before receiving VOXZOGO. Please see important safety information at the end of this video.
When we found out Miller had achondroplasia, we were in the hospital and the pediatrician said that there was probably something wrong with Miller. It wasn't until 10 days later we went to the hospital and we went to the genetic specialist, and right away she said Miller has achondroplasia.
My name is Miller. I am 13 and I have achondroplasia. I like to drive tractors and I mow with them. I back in trailers. I like to go fishing with my dad and we catch crappie.
Miller's personality is rambunctious, fun-loving. He's got a sense of humor. He always likes to joke, have fun.
Miller makes us laugh every day. We learned about VOXZOGO at a conference. The doctor at the conference said the treatment would help Miller grow. When we first discussed the treatment, Miller was actually there with Chris and I, and we made it a group decision.
The main reason we started the treatment is because after researching it, it was Miller's final decision. So then we went to our specialists and we talked to them. We started getting all the information and we said it was worth it. The questions we had for a daily injection were, the main questions of like, where do we give the shot? Kind of like what Miller's question was, how big is the needle? And what happens if we miss a shot? And so they went through all that information with us, showed us exactly where we could give the shot, so it was easy for Miller and more comfortable for him. We worked with our clinic and they showed us how to actually mix the shot, how long we had to wait before we could give the injection, how long it had to sit out before we even did that, and then where to give the shot.
When we thought about doing a daily injection at home, it was more our timing, our schedule, will we get it done? When we first started the injections, Miller was nervous at first for about 2.5, 3 months.
When I first heard about the shot, I was scared because I don't like needles. When I took the shot, I put a pillow over my face so I didn't see it. It's gotten easier every time because I'm used to it now.
From day one, and today, he still covers himself up with a pillow on his face.
VOXZOGO is a prescription medicine used to increase linear growth in children with achondroplasia and open growth plates. The most common side effects of VOXZOGO include injection site reactions, including redness, itching, swelling, bruising, rash, hives, and injection site pain, high levels of blood alkaline phosphatase shown in blood tests, vomiting, joint pain, decreased blood pressure, and stomach ache. These are not all the possible side effects of VOXZOGO. Please see important safety information at the end of this video.
We measure Miller at the doctor's office, and then at home, Miller and I will measure up against our doorway. Every time we measure him as he gets taller, Miller lights up.
What Miller makes me the proudest is his determination.
For the parents considering VOXZOGO, I would tell them to have lots of patience at first until your child gets used to the daily injections.
If another kid was into trying VOXZOGO, I would recommend it to them. VOXZOGO helps me grow.
Important safety information. What is VOXZOGO used for? VOXZOGO is a prescription medicine used to increase linear growth in children with achondroplasia and open growth plates, epiphyses. VOXZOGO is approved under accelerated approval based on an improvement in annualized growth velocity. Continued approval may be contingent upon verification and description of clinical benefit in confirmatory trials. What is the most important safety information about VOXZOGO? VOXZOGO may cause serious side effects, including a temporary decrease in blood pressure in some patients. To reduce the risk of a decrease in blood pressure and associated symptoms, dizziness, feeling tired, or nausea, patients should eat a meal and drink 8 to 10 ounces of fluid within 1 hour before receiving VOXZOGO. What are the most common side effects of VOXZOGO? The most common side effects of VOXZOGO include injection site reactions, including redness, itching, swelling, bruising, rash, hives, and injection site pain. High levels of blood alkaline phosphatase shown in blood tests, vomiting, joint pain, decreased blood pressure, and stomachache. These are not all the possible side effects of VOXZOGO. Ask your healthcare provider for medical advice about side effects and about any side effects that bother the patient or that do not go away. How is VOXZOGO taken? VOXZOGO is taken daily as an injection given under the skin, administered by a caregiver after a healthcare provider determines the caregiver is able to administer VOXZOGO. Do not try to inject VOXZOGO until you have been shown the right way by your healthcare provider. VOXZOGO is supplied with instructions for use that describe the steps for preparing, injecting, and disposing VOXZOGO. Caregivers should review the instructions for use for guidance, and anytime they receive a refill of VOXZOGO in case any changes have been made. Inject VOXZOGO one time every day at about the same time each day. If a dose of VOXZOGO is missed, it can be given within 12 hours from the missed dose. After 12 hours, skip the missed dose and administer the next daily dose as usual. The dose of VOXZOGO is based on body weight. Your healthcare provider will adjust the dose based on changes in weight following regular checkups. Your healthcare provider will monitor the patient's growth and tell you when to stop taking VOXZOGO if they determine the patient is no longer able to grow. Stop administering VOXZOGO if instructed by your healthcare provider. What should you tell the doctor before or during taking VOXZOGO? Tell your doctor about all of the patient's medical conditions, including if the patient has heart disease, cardiac or vascular disease, or if the patient is on blood pressure medicine, antihypertensive medicine, if the patient has kidney problems or renal impairment, if the patient is pregnant or plans to become pregnant. It is not known if VOXZOGO will harm the unborn baby. If the patient is breastfeeding or plans to breastfeed. It is not known if VOXZOGO passes into breast milk. Tell your doctor about all of the medicines the patient takes, including prescription and over-the-counter medicines, vitamins, and herbal supplements. You may report side effects to BioMarin at 1-866-906-6100. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/MedWatch or call 1-800-FDA-1088. Please see additional safety information in the full prescribing information and patient information at voxzogo.com.